What is a meaningful change in a clinical trial? When clinical trials are done to evaluate treatments, they should focus on outcomes that matter to patients or their caregivers. Outcomes should represent something that patients or caregivers would like to see change in response to a treatment. Caregivers of children with cerebral creatine deficiencies decided on some outcome areas that are important to them for improving their child's life. These include expressive communication, being able to express needs effectively, cognition, which is how you learn and think, daily living skills like bathing, toileting, and dressing, fine motor skills like manipulating objects in order to do things at home or at school, and emotional dysregulation, having difficulty managing different emotions. We now need to ask, what is a meaningful change in these areas? This is not only defined by how many points on a test their child gains to show improvement, but what skills or different behaviors would the caregiver want to see for them to say, "This treatment is working." The changes a caregiver would need to see to decide that a treatment is working may be different for different treatments. Why? Treatments differ in how much time they take, how comfortable they are, and whether they have side effects or risks. How a caregiver defines a meaningful change for their child, or what they would need to see to decide if a treatment is working, might be different for easier, standard of care, and low-risk treatments than for treatments that are time-consuming, uncomfortable, or have more risks. This is because a caregiver might be thinking about whether a change in an outcome is worthwhile given what is involved for their child to receive the treatment or how much risk there is. So now we are going to ask you, what would you think you would need to see as an improvement for you to say, "Yes, this is a meaningful change"? And is this different for different treatments?